With some terrifying developments abroad, we have a case of suspected bubonic plague in China's Inner Mongolia, with authorities in China stepping up precautions after the city was exposed and has a confirmed case there. So look, of course, these types of stories, they start to bubble up, but in my opinion, I think we should probably pay more attention to pandemic potential diseases that are coming out of China. Of course, bubonic plague already, caused a worldwide pandemic in the 1300s, but we can also throw up on the screen something we covered last week about another disease which is said to jump from pigs to humans, new swine flu, with also, quote, pandemic potential identified by Chinese researchers. So these are just things that we should obviously have to keep an eye on. I mean, nobody thought the coronavirus thing would go pandemic, and then it did, largely because of the way that it was mishandled. But if you mishandle something once, maybe you'll do it again. And that's a good reminder that things on coronavirus are not going so well right now in this country, are they?
Yeah, not like our handling is going very well either. On the bubonic plague thing, just a few more details. This was a herdsman in the Chinese region of Inner Mongolia. I didn't know all of these things, so I thought I would share them with you. First of all, there's a few cases apparently of bubonic plague, which of course was the Black Death, that are diagnosed every year. Yeah. So this is so I don't want to totally freak people out. This has never happened, but this happens a few times every year. It is much more treatable now. And the herdsman is apparently in stable condition in the hospital. So I want to give you that update there. But yeah, I mean, in terms of coronavirus, this continues to be a disaster. I'm just going to list to you from the New York Times the states in which new cases are decreasing. So this is a full listing of the states in which new cases of coronavirus are decreasing. New Hampshire. That's it. Everywhere else, cases, there are about 11 states, I think this is, where total cases are mostly the same. And then everywhere else, you're seeing growth. And in some places, you are seeing skyrocketing growth. Places like Arizona, places like Florida, places like South Carolina. And you have the former FDA commissioner, Scott Gottlieb, who is warning that, one of the things that we've been saying is, okay, case numbers are really going up dramatically. We're hitting new highs, new horrific records. But fortunately, deaths have continued to decline. Well, he is warning that is very likely to change. Let's take a listen.
But this is still a very deadly pathogen, and it's still going to claim a lot of lives. Even if we cut the case fatality rate in half, which is possible with some of the treatments and the innovations in care that we've introduced in the last couple of months, if we infect twice as many people, we're right back where we started from. And so this is still something we need to take very seriously and control.
Yeah, I mean, important point there from Scott. And Scott really is one of the best voices on this, former FDA commissioner. And what he's warning is basically that, yes, right now the situation is under control to a certain respect. And what that means is that, yes, there's very high level of cases. However, the fatality rate is not even close because it's largely younger people who are being infected with the virus. He's warning that this could change. But what really scared me about Scott's interview there is talking about how we're basically where we were with New York in several different states. In Texas, Arizona, I think he said that Georgia and Florida are two of the hardest hit states there. You saw the Texas governor institute mandatory masking in public, and I think that's probably a policy that will go throughout these states. But also, these are states which are huge, which people travel in and out of all the time. There's a lot of intrastate and interstate travel within these places, and that people will visit from other parts of the country the way that New York did and originally spread the virus there. So the real issue I have here is the federal government just doesn't seem to be acknowledging this. I mean, we haven't had a coronavirus task force briefing or something like that in a very long time with Dr. Fauci or any of the others. At least trying to, people are just kind of throwing up their hands and hoping for the best. And at this point, I honestly don't even know what we could do because the virus is so widespread. It's such a disaster. It's gone so pandemic that at this point, I don't know what other options we have, considering we crashed our entire economy. The Congress refuses to step up the game, that most people are just I don't know what to do. I'm scared, but I literally don't know what to do. Well, it's a bad position to be in right now.
Probably one of the worst things that has happened in all of this is the whole, first of all, getting lied to about face masks. And then face masks becoming some sort of weird politicized culture war issue. I mean, that's probably the most devastating, maybe the biggest reason why we're seeing the spikes that we are right now is because of that exact fact. I mean, I was reading an analysis of essentially, look, you look around the world and we are doing worse than almost anywhere.
Right.
I mean, we are among the worst nations in the world in terms of how we are handling this and the spikes that we're seeing. And essentially, there were two models that were fairly successful. There was the model that we saw in some Asian countries of like total
shutdown.
absolute shutdown, hardcore from the beginning, and knock it out and then move on. And that worked pretty well.
And universal masking.
Yes, and what you're seeing in a lot of Western European countries that are doing well is they did have mass infection spikes. They did not shut down as hard, but they've been much more careful about reopening, and you have a lot more compliance with masking, and that didn't become this like weird culture war
economic
issue.
stimulus. That's right. I think that's what.
And I think that's exactly right. And I remember Ryan Graham said at the very beginning of this thing, he was like, economic response is health response, because people are not going to comply if they aren't taken care of, if they don't feel like they could stay home and be safe and be able to maintain like their life and their livelihood. And I think that's exactly what we see.
Yeah, I think that when people have so much economic uncertainty and so much uncertainty about life and everything else, family, schools, how many parents out there taking care of their kids, right, who are like, I don't know when my kids are going back to school. You add all of that together and it just creates this bubbling anxiety. You give people no certainty about everything. That is what puts people on edge. And that's why I feel like we're losing our minds collectively every single day. And that is where I think more than anything that we failed is in order to give people real certainty at the core of their lives that everything is going to be okay. But that's just not been the case, and that's what has everybody on edge. That's what has the Black Death trending on Twitter, right?
Yeah.
Like, people see this, they're like, well, it happened once. We lived through it once.
Yeah.
And so now, who knows? You know, like I was talking about upper bounds and probability and all that, the whole realm of what was acceptable and not, and how we're afraid and whatnot, and just our expectations of our government in terms of crisis, how it all ended up turning out is not something that inspires a lot of confidence, and I think it's very much why we are where we are.
Yeah, I mean, that Pew poll, 17% of Americans saying they feel proud of the state of America right now. I mean, is unbelievable. But you can totally understand where they're coming from. More Rising for you after this.